Hi, Catherine. My name is Brianna. I am going to be your nurse today. What brings you in here today?
Hi, Brianna. I came in today because I have been having a lot of pain all over my body and I just can't seem to get it under control.
Ooh, I can't imagine how that'll feel, pain all over your body. How long have you been experiencing the pain?
Um, it's been going on for a little while now. I would say at least since around Christmas, I've noticed that it was getting worse.
Oh, so that's been about 3, 4 months. Can you describe the pain?
It kind of feels like aching all over my body. Some areas I feel some burning. My arms and legs kind of feel like there's pins and needles in them, and they're just really tender to the touch.
Okay. Do you know what causes the pain to start?
Not really. I know that I've been under a lot of stress lately.
Where is the pain located?
All over my back, my neck, my arms, my legs. Sometimes I even feel like my knuckles and joints are swollen.
On a scale of 0 to 10, what number would you rate your pain?
I would rate it around a 6 right now, but there's days that it's around a 10 all day.
Is there anything that helps relieve the pain for you? Is it in the morning and the evening that your pain is bothers you more?
Um, it bothers me all day. I do take Tylenol and Motrin to help with the pain. It only helps a little bit lately. It hasn't really been helping me.
Okay, thank you for your information. I am going to go get the doctor and let him know everything that you told me.
Okay.
Thank you.
Hi, Catherine. I'm Dr. Cloud. How are you today?
I'm okay, just in pain. How are you?
I'm good. I'm sorry to hear that you're in pain. We're going to try and do our best today to help you out. I looked over your medical record and heard what the nurse got from information from you. I also see that you have had a history of depression and anxiety. Is that correct?
Yeah.
Thank you for sharing that with me. Are you currently taking any medications or seeing anybody for therapy to help you deal with your depression?
No, I didn't have insurance for a little bit, but I just got it back. I got a new job, so I was able to get insurance back. So that's why I finally came back to the doctor.
Well, I'm glad you have insurance now so we can help treat you better. The nurse also let me know that you've been under a lot of stress lately. What would you say are the biggest sources of stress in your life right now?
Well, my job's pretty stressful, school's pretty stressful. I don't really sleep well anymore. I don't, the pain's been waking me up from my sleep. I'm always so tired and sore. Um, I've been calling off of work in the mornings. I just can't concentrate, and even trying to nap, it doesn't work.
Mm. Well, that does sound like you have a lot on your plate to deal with right now. With the information you've given me, it could be a few things. So I would like to get some blood work drawn from you so we can rule out other conditions such as arthritis or vitamin deficiencies, thyroid dysfunction.
Okay. How long do you think it'll take to get those labs back?
Well, we do our labs right on the facility here, so hopefully it will come back before your appointment's over. I know I'll be taking labs to look at a complete blood count, your thyroid function, vitamin D specifically, ESR, ANA, rheumatoid factors for immune-related arthritis, and then I'll have the nurse take those from you, okay?
Okay.
Hello, I am going to get some labs from you.
Alrighty, sounds good.
Here are the lab results. for you, Dr. Cloud?
So when I look over your lab results, most everything comes back normal. It doesn't show you have any vitamin deficiencies or any arthritis problems. But it does look to me with the results of this that it sounds like you might have fibromyalgia.
What's that?
Fibromyalgia is a disorder characterized by widespread pain throughout the body, mostly in the muscles, and it can affect the joints. It also is accompanied by a very big disruption in sleep, having you feel fatigued, affecting your mood, how you're not able to concentrate. It sounds like you have a fog, which can be called a fibrosis or a fibro fog.
Okay, that makes a lot of sense with how I've been feeling lately. Do you have any tips or tricks that I can do to help manage my symptoms?
With this disorder, there isn't a cure, unfortunately, but there is a lot of things we can do to help you manage it and lessen the pain so you can function on a day-to-day basis better. With this, self-care is very critical, so you need to take more time to focus on you in your life. You're going to want to try and set limits to how stressed you get in a day or have something to help you relax and unwind when you get home. You don't want to overexert yourself, even if you feel like you're having a good day, or you could be in a lot of more pain than you normally would the next. And then a big thing is your sleep hygiene. You're going to want to avoid electronics and a lot of commotion an hour before bed. You'll want to kind of try to have the same sleep schedule every day and morning you get up, and then exercise on a regular basis. And if most of this doesn't help after you've been doing it for a while, we can look into physical therapy or other counseling.
Okay, thank you so much. Now, I can try all that stuff, but what can I do for the pain?
Well, with pain, there's not a lot of medications we give specifically for that, so you can stick with your over-the-counter medications such as Tylenol and ibuprofen. But a main thing I would like to try that's new is helping to treat your underlying conditions like your depression. So I want to start with low doses of an antidepressant medication that is shown to also help the pain in fibromyalgia. So we can kind of hit two birds with one stone here.
Okay, what kind of medication? What's the name of it?
We'll start off with a medication called Savelia. It treats depression and pain. And if those don't work at your next checkup, because keeping in mind these medications do take quite a few weeks, at least 3 to 4 before we start seeing results in it, we can discuss muscle relaxers such as a cyclobenzaprine to help promote your sleep.
Okay, I'll try that.
So do you practice any religion or spiritual practices?
I practice Christianity and sometimes I go to church, not always.
I know a lot of people can find comfort and a big stress relief looking into a spiritual outsource by praying or venting to your higher power. That can help with stress relief and help you relax at the end of the day if that's something you are interested in trying.
Okay, I didn't even think about that. Thank you.
You're welcome. So it was very nice talking to you today, and I'm going to send off those prescriptions to the pharmacy that you've indicated you want us to use. And then I'm also going to refer you to an outpatient therapist for you to continue to talk about your feelings and to help manage your depression and anxiety, because it's important to treat the mind as well as the body. And then we'll complete the remainder of your visit with tips from the nurse about helping to maintain a better lifestyle for your fibromyalgia.
All right, thank you, doctor.
Thank you.
Hello, Catherine again. My recommendation for you is to try to maintain a healthy diet by maintaining your caffeine intake and alcohol consumption. Don't exert yourself on a daily basis. And as the doctor said, getting good sleep is essential. Massage therapy and yoga can also help with the pain and treatment.
Okay, thank you so much.
You are very welcome. Are there any other questions you have for me?
No, I don't think so.
You are welcome. If you have any questions, please feel free to call the office and speak with us. We are more than happy to help you.
Okay, thank you. I hope you have a good rest of your day.